to the world, really, and Uganda. Everyone was grappling on what to do about it. Specifically, people in Kampala, urban slums, we already know that urban health is a big issue and usually poor health outcomes overall. So we set out to find out how slum communities or communities in informal settlements, which comprise about 60% of Kampala's population, we set out to find out how they were coping, how they were adapting to this pandemic.
ALERT is an acronym that stands for Adherence, Lived Experiences, and Resilient Transformation in Slums in COVID. The study focused on understanding the experiences of slum dwellers when it came to the pandemic, their understanding of the standard operating procedures put aside by the government of Uganda together with the Ministry of Health to combat the spread of COVID-19. The study was conducted in Kampala, Katawa, and Bwaise, Mombasa.
It applied a mixed method by using both qualitative and quantitative approaches. We applied both approaches because we wanted these two approaches to complement each other. The study enrolled 807 participants, whereby 660 participated in the quantitative arm and 147 participated in the qualitative arm. We used a survey, key informant interview, in-depth interviews, and focus group discussions. We recruited participants both at community level, division level, and national level.
In terms of what we found that first of all we were wondering were they aware of this pandemic and how lethal, how dangerous it is. So they were aware, however they were not complying with the prevention guidelines or SOPs as we know them. Now this non-compliance or non-adherence to SOPs varied across the different SOPs, but then it also varied across different social demographic characteristics. So in terms of SOPs, we found that things like hand washing were slightly better practice than, of course, sanitizing or staying at home was just not an option for people in the slums. They had to go and look for food, and so they ended up contravening even the curfew when it was still operational. We found that there were a number of explanatory factors for this non-adherence, which were social, they were political, they were economic mostly. And then we also found that there were a lot of spillovers, both positive and negative, but mostly negative. The negative spillovers included things like domestic violence, violence against children, violence against women, and violence against men.
Social distancing among slum dwellers is practically impossible. So we should emphasize two major things. One is hand washing and masking, which are practical within this community. The second one is education to eradicate myths which surround COVID-19 infection. Number three, we need to address violence against women, against girls, against men within the community itself, using community leaders and spiritual leaders as the drivers of change. Number four, we need to be looking at livelihoods and food security for these community slum dwellers. We should be looking at health education messages which address adolescents and young people.
So we were trying to engage with the National COVID Task Force and the division leaders, the enforcers of the SOPs or presidential directives, and telling them that look, these things need to be reviewed, and some SOPs or some preventive measures emphasized more than others, like compared to others. So emphasized maybe mostly hand washing and putting on masks as opposed to the others, which are just not feasible. Some categories of the population were not well targeted initially, like the children. There were no child-friendly messages. Even the products were not child-friendly, like the masks. Initially, they were not there. But now, as we see, things have shifted a lot. There are COVID messages for children, by children, with children, which is brilliant. And our study was one of the very first ones to flag up that gap. We obviously built these solid and very important partnerships with community leaders, with national leaders, with leaders at the sub-national level, at the division level, here in Kampala with KCCA and so on. So we are going to continue engaging them and supporting them as they support their communities in return. The current issues have to do with schools have just reopened, which wasn't the case at the time when we were conducting this study. So we have to deal with current issues. As we know, schools have reopened. There's been a surge in teenage pregnancies, and yet the government has said that they can allow pregnant adolescents, teenagers, schoolgirls, or those who are nursing babies to re-enter school. The question is, how exactly do you do this? So we are trying to design interventions, packages of intervention to support health and educational outcomes of these teenage girls, basically respond to current issues as they emerge. Also, we want to continue mobilizing resources as we look at the current needs, which might not have been the same needs as before. But working together with the people who are closest to these communities.
The study was funded by the government of Uganda through the Makerere University Research and Innovation Fund. It was conducted by Makerere University under the Center for Health and Socioeconomic Inclusion together with Gulu University.